Full Bloom is brought to you in part by the following. Welcome to Full Bloom, the award-winning show that celebrates life. Here's your host, Zita Christian.
Everyone, welcome to Full Bloom. I'm Zita Christian. Those of you who watch the show regularly know that I often choose subjects for the show that have a personal interest to me, and that's exactly what I've done tonight. Tonight, we're going to talk about Medicare. Why? Because Dick and I are suddenly faced now with having to learn a lot about Medicare that we really thought we would wait a while and find out. And having to learn about it really fast has been confusing. And so I thought, if I need help figuring this out, I bet some of you do too. I'm very fortunate that I found someone who has lots of information and a great way to present it. And I asked her to be on the show tonight. Her name is Anita Fischer. Anita, thanks for being on the show tonight.
Thank you. It's my pleasure.
Good. I know when we spoke on the phone the first time, I'm sure that I had to have sounded like many of the people who call you that first time, and I just totally confused. There's things about plans, and there's parts, and there's the whole alphabet, and I just simply couldn't make sense of it. So I wanted tonight to give the audience, I think, what might be called Medicare 101. And I know we won't get to everything tonight, but we'll get to some of the main topics and maybe clarify for people who find themselves in the same situation that we're in. So first, if you could tell us what is Medicare and who's eligible to receive it.
Well, it's funny that I also call it Medicare 101 when I see my clients. Medicare is an insurance program for people that are over 65, also for people that have certain disabilities under 65, and for anyone at any age that has end-stage renal disease, kidney failure.
Oh, I didn't realize that.
Yep. And also, you have to have entered the United States lawfully and resided here for 5 consecutive years.
Okay.
Okay.
All right. So for this show, because I know we can't cover everything, and because, as I said, I do have a very personal interest here in getting this information, we're going to focus on those people who are eligible for Medicare because they're 65 or older.
Okay.
Okay, so, and some of the other stuff may come up, but this is the part I want to focus on. So one of the things that confused me right off the bat was the parts and the plans. And I thought, 2 words, each has 1 syllable, each begins with a P, part and plan, part and plan. Why couldn't they come up with other words? Because I find that so confusing, that there are parts and there are plans and there are plans underneath parts, and it's confusing. So would you clarify the parts?
Okay. When we talk about Medicare, we are talking about parts. Okay, Part A, Part B, Part C, Part D. Okay, we're not even going to talk about plans yet because plans are later.
Yes.
This is just the original Medicare.
A, B, C, D.
A, B, C, D. Okay. Started with A, okay, which is hospitalization. For people that have paid into the system for 40 quarters, they get it for free. That's hospitalization for free. You don't have to pay for it. However, there is a deductible and there are co-pays. The deductible goes up every year.
Yes,
like
so
everything else.
Yeah.
This year I think it's $11.32. And after that, if you go into a hospital and you do have, let's just say, a $100,000 bill, you're responsible for $20,000 because it's 20%. It's an 80-20. Now, Part B, which is the medical, and that used to be where you would have to opt into it and ask for it. Lately, they've been people that have turned 65 and actually collecting from Social Security already will automatically be put on Part B and a card will be sent to them. But people that are like Dick, okay, and been on something else, and he's older, and he would have to apply. When he gets off of employer or union or any kind of other insurance, then you have to apply for Part B, like myself. believe it or not,
Yes.
I'm turning 65. And so I also had to apply because I'm not collecting. Okay, so you
Okay.
have to go to Social Security. You have to fill out, fill out some papers. You have to answer some questions, and then you apply that way. So that's Part B.
Okay, but
that's for the medical.
Okay, but right off the bat, I think, okay, Part A is the hospital, and Part B is medical. Well, excuse me, when I think of going to the hospital, I think that that's something having to do with medicine.
Okay, one is doctors.
So
okay.
B is the doctors, the
doctors,
providers.
the labs, if you needed blood, things of that nature.
That's Part B.
Durable medical equipment, that's all under Part B. They call that medical. The hospitalization is hospitalization.
Like being in the hospital.
Being in the hospital.
Okay, in the hospital is A, the doctors and the
Any
durables
kind of-
and the blood in the
right.
lab are B. Okay.
Right.
Okay.
Okay.
And what's C?
And the B, again, you have a deductible of $162 this year. Okay, that goes up. And then it's an 80-20 split again. Now, that's not too bad. You go to a doctor, it's $100, so you're paying $20. That's not too bad. Okay, it's the hospitalization, which skilled nursing falls under as well. Okay, so you have to go into a nursing home. That's also a hospital.
Okay.
So,
So
and then you have co-pays. This is the original Medicare. You have co-pays for different days, and, there are times involved that it can get confusing unless you have it in front of you and you can see, basically. But just let's think about it as Part A as hospitalization, Part B as medical.
Okay.
Okay, doctors, durable medical equipment, oxygen, things of that nature.
Okay.
Then we have they came up with Part C.
Yes.
Which is the Advantage plans. They call them the Advantage plans. And these Advantage plans are really with private companies. So if a private company, and this is administered by CMS, the Centers of Medicare and Medicaid. They do all the administration for Medicare. So if there was a private company that wanted to get into this field, they would come to CMS and say, well, we'd like to, participate. Oh, well then, they say, if you want to participate, then you have to give the seniors or the people on Medicare the same as the original Medicare or make it better. So many of the companies did make it better. And with the C, okay, these Advantage plans, Medicare actually pays the private company to administer and manage you, okay, or the person that's going to be going on this plan. And so when you go to a doctor or to a hospital, you don't show them your Medicare card because Medicare is not going to pay twice. You would just show them the private company's card. Okay, so there's your HMOs, your PPOs, your private fee-for-service, medical savings plans, and things of that nature.
Okay, and that's Part C.
Part C.
But A and B was
the original. I think that was the original.
Okay, and that is managed by Medicare. Or by Social Security office.
And you need to have A and B to purchase a C plan.
Okay, so they want to know that you're in the Medicare system to begin with before you can get C.
Yes, because Medicare is going to be paying for you, so you have to be have contributed those 40 quarters.
So is C the same as B, except it's a private company?
No.
So what does C cover?
C is the Advantage plans.
That
covers, that can cover. These Advantage plans a lot of the companies are different, but most of them, on an average, will cover your hospitalization, your medical, and your doctors, your laboratories, and also give you prescription drug plan, which is Part D.
So from regular Medicare, you have A, B, and D. But C, God, Anita,
Oh, I know. No, D is really just your prescription drug plan.
Okay.
So if you have a Medicare supplement, not an Advantage plan, which is a Part C, and we just take that out of the mix, just have A and B, okay, and you decide, I want to go to a Medicare supplement, not an Advantage plan. That's where the plans come in. This is where you get confused. This is where the parts and the plans get crazy.
Yes.
Okay, so let's just think of it as A, B, C, and D as parts of Medicare. And then you're going to purchase something that covers all of the things that Medicare does not. The 20%, sometimes the deductible, depending on the plan. A, B, C, D. Well, they took E away. F, G, okay. So depending on the plan, depends on the actually the different benefits on the plan. Some of them you still have to cover your Part A deductible if you have a Plan A. Some of them you have to still cover your deductible for the doctors. It just depends on the plan that you choose. We're very lucky in the state of Connecticut. In the state of Connecticut, this is a guaranteed issued state, which means that no matter what, there are no health questions, it doesn't matter what you have, you can get a plan. Okay, so what it comes down to
What do you mean
here,
what you have? You mean a pre-existing
there are
condition?
other states, that have pre-existing conditions, that go up on in premium if you're older, if you're ill, if you have something wrong. Yes, we're very lucky here. Okay, none of that. You can purchase any plan you want with a Medicare supplement plan, not a Part C Advantage plan. You can change those anytime you want.
All right, so just, I want to
Go ahead.
I want to get even smaller here and just look at A, B, and D.
Okay.
So again, we're talking parts. Part A, hospital. Part B, the providers, the doctors, the blood, the labs. Forget C for a minute.
Okay.
Part D, the drugs. Okay?
Yeah.
So under Part A, there are no other plans, but under B, you can buy a supplement.
No.
Part,
You don't
No?
really, it's not under B. It's if you have A and B together.
if you have A and B,
You have to have A and B together.
and then you can buy a supplement to cover what B does not cover.
And the reason they do that is because there are some people that have not paid 40 quarters into Medicare, and they can purchase Part A. Okay? So if you have A and B, depending on the monies that Medicare is getting, so it depends. Okay, but most people have. So on the average, most people, the majority of the people have A and B.
Okay?
Okay, and they're paying for B.
So it's kind of like...
They're paying for B. You realize that?
Yes.
Okay.
Yes.
So you're paying this year, I don't think we stated this before, or I did not. I think it's $115.30 or 40 cents, something like that. So you're paying for Part B.
And Part B covers 80% of what it covers.
Medical.
Of the medical.
Right.
And so then you can buy a plan that
A
will...
regular Medicare supplement, Medigap. You've heard that word. Medigap, Medicare supplement. Whichever way, it's the same thing. Okay. Then you can purchase a plan.
A plan,
Not
yes.
a part, but a plan. Okay. Whichever plan, it comes down to money here.
And that's why I think it suddenly dawned on me after talking with Anita Fischer. I realized why some of my neighbors had made comments in the past about, oh, I love Medicare, my father was on Medicare, it covered everything was great, and yet somebody else would say, what's the point of having it, it doesn't cover anything. And I thought, well, how could that be? But when I realized, well, number one, one of the statements was an exaggeration, but that there are so many different plans one can choose from to go along with the parts, and some plans cover more things than others, or more items and a greater percentage of things. So, and of course you pay.
You pay a little more, but it depends on the company, because don't forget, there's a lot of companies in the state of Connecticut too. So you have companies and you have plans.
Yeah.
And then what it comes down to, basically, is money. Or the company that you like. You know, somebody might say, I like this company. Somebody says, no, well, I like this company. Well, okay. Well, this one pays a little bit more because they want that name recognition or whatever reason. Okay? So it depends on the person. Everybody is different. And they feel, I want this company or that company or this plan or that plan.
Now,
and they pay for it.
I want to mention something right now, though, just for those of you in the viewing audience. if you're listening to this and you are as confused as I was a couple of days ago, there are a lot of resources out there, and we're going to talk about that a little bit later too. But when you see Anita's identification underneath, when she is on the camera, you'll see an email for her, and I've asked her if she would let us put her email on the screen in the event that you have questions, in the event that you would like some clarification. And Anita is one of many insurance brokers who would be happy to tell you about the whole Medicare process. You can also go to the Senior Citizen Center probably in your town. I know Manchester has several, I believe, social workers who work through the center, and you can make an appointment with them and they can sit down and talk with you about this too. Because it is, at least for me anyway, initially when Dick and I first looked at it, it was very confusing. It's not quite as confusing anymore, and I thank you for helping us to clarify that. So let's get back to some of these parts A, B, and D. So yes, let's look at part D, and that's the drugs.
That's the prescription drugs plan. That came in 2006. President Bush, I think, put that in. And the big thing with the prescription drug that people were complaining about was this donut hole. Everybody called it the donut hole, but I really call it the black hole.
Yeah.
Most of the people that fall into it don't come out. Okay. However, what that is Part D has different stages. Some plans have deductibles, some plans don't. Okay, some plans depends on, again, price. Okay.
So again, we have Part D, but there's a whole bunch of different plans that you can get.
Different companies.
Different companies plans. Offer different plans.
Right.
Under Part D.
Right, and it depending on how much medication you have would really depend on what you would look at. And depending on what medications you take is another thing, because on these each company has a different formulary. Some formularies are 89% of the drugs, some of them are 93% of the drugs. So you want to make sure that...
What do you mean they're 80 or 93% of
from all the drugs that are out there.
Oh, you mean from all the drugs that are available?
All the drugs that are available to you.
And the list of what they cover is their formulary?
That's correct.
Okay.
Okay, that's what a formulary is.
I'm getting it.
I'm getting it. Me now.
Oh, so go that far.
So that again would depend on the individual. Everybody is different, and so you can't. Even a wife and a husband are different, and they can go on different kinds of plans for whatever different reasons. So you do have deductibles. You have different stages. One of the stages after your deductible stage, you have, I don't know if it's stage 2, you want to call it. This is where the company, you're paying a copay for your drugs, and the company will pay the remainder. However, the retail price of what the company is paying and what you're paying, the retail price of that drug, of all your drugs, when it reaches this year, $2,840, then you fall into this donut hole, and you are responsible. It was, before this year, 100%. This year, they're trying to close this gap. It's 50%. That's good. So you're paying 50% of the retail price.
Of the retail price. So let's say Dick is taking a prescription and the retail price is $100. Mm-hmm. But through the plan that I have chosen for Part D, I've picked a plan that pays that we only need to pay $20 for that drug.
Your copay.
My copay is $20.
Okay.
I'm making this up, so I don't know if it really works.
Okay.
If there's a plan that's exactly like that, but let's say that I'm paying $20 for that drug, but that drug costs $100. So there's that other $80, and the plan that I picked is paying for that.
Right.
But at a certain point, the full retail price is being added up. And when that full retail price, not the amount I pay, but the full retail, when that hits $2,800, combined for all the drugs, not let's say he's on 2 or 3 drugs, it's the combination of all of them, right?
Yes.
Not for each one.
Yes.
Okay. So then at that point they say we don't pay anything anymore at all.
Right.
And then
you're in that hole.
You're in the hole, and you pay the next
50% of the drug this year. So if the drug was $100, you'd be paying $50. That's better than last year. Last year they paid $100.
100%.
Yeah, 100%.
Is there any chance of it closing
next year? So they're saying it should be 75%, but we really never know. So I don't like to say, but I just did.
Well, I mean, we can be hopeful.
It's supposed to be 75% next year. So let's see what happens.
So how should people keep abreast of what's going on? I mean, is it just a matter of you
There's
listen
so much
to
information out there, but the information can be confusing when you start reading it.
Yes.
So the best way to break it down is this way: A, B, C, and D.
Yep.
Okay, and then take each part of the Medicare and figure that out. Just what we're doing now. This is the best way to do it. But let's say somebody is confused about the prescription drug plan. There's a couple of things they can do. Okay, one, they can go to, if they have a computer, you can go to Medicare.gov and click on the prescription for prescription drugs. You can put your drugs in there, and it'll pull up. They'll ask for your zip code. It'll pull up all the companies that they would recommend, or the best ones for you.
Yeah,
could be 3,
there's a
could
lot
be
of
4.
information.
Yes, there's a lot. So you can do that, or you can even call companies and tell them your drugs, okay, and they can tell you if they're a tier 1, a tier 2, a tier 3.
And does that depend on the company? I mean, like some companies might call it a 1, and some other company might call it a 2.
That's right.
Oh my gosh! And
So this is.
And the tiers, depending on the tiers, let me guess, has some factor about cost.
Exactly.
Of course. Oh my gosh.
Exactly. So there's some companies that, of course, I'm not going to mention any names because there are a few that have their own pharmacies. Okay, so sometimes it's cheaper to, more inexpensive.
Yeah, it's gonna
cheaper.
cost money. Yeah, however you look at it.
It costs you less if you go to that company, depending on the drugs. Okay, so it depends on the drugs that you're taking. Okay, where you would go. And that's where I come in. People like myself, okay, I help a lot of people. I can do it right on the phone. You can key it in and figure out what's best. It's a little research that you have to do.
Yeah, and I think for a lot of people, it's not so much that the research itself, that research in general is daunting, but if you're like me, when we first started looking at this, I just simply wasn't aware of the realm. And you need to know the players, and you need to know the rules. And once you get that, then it's not so bad. And that's why people like Anita Fischer, are so helpful. And as I said, there are a lot of other people around who do this. You can go to the local senior center in your town, call them up, ask what kind of services they have that can help you work through this maze. But the timing is important, and that's what we're going to talk about next. When does a person sign up? There a good time, bad time?
Just before I answer that question,
Yes.
You had mentioned something I really want to address. When you go to that senior center, okay, make sure you ask them if you qualify for the medical savings program. A lot of people qualify for it and they don't realize it. Okay.
Oh, what is that?
Some people, if they're on a very low fixed income, well, I don't know how low. Some of them it's not so low. Depending on what it is, there are 4 different stages. Some will pay for Part B because you're paying $115.30 or 40 cents this year. It'll pay for Part B. It'll pick it up. It'll help pay for prescription drugs, okay, depending on your income. So when you do go to that senior center, and I send many of my clients there to fill out the papers for some of these programs.
That's good to know.
Yeah.
So other than that, I mean,
plus the fact, the people that are paying $115.30 are making less than $85,000 a year.
okay.
If you make over $85,000 a year, there are different prices, and it goes up each with different levels.
Okay.
And so they're paying more. It can go up to, I think, $369.10 or something
Wow.
a month per person if you're making over a certain amount.
Oh my gosh! So get yourself a little calculator.
Oh, yeah.
For sure, for sure. So let's say that I sign up for Part B. I have A, and I mean I don't, but suppose I did. Suppose I
You're
have
turning
A.
65?
Not yet.
Okay.
Yeah, but I will. You know.
No, I'm just saying. Is that what you're giving me a scenario?
Oh,
as
the scenario. Yeah.
the
So
scenario?
here's the scenario: 65, have Part A, sign up for Part B, buy a supplement plan under to pay the other 20%, and then let's say 6 months later, I realized I want a different plan, or Part D for the drugs. I realize this one isn't working. Excuse me, I need a different plan. Can I change?
No. You can't change the Medicare supplement plan, the Medigap plan. You can change that like you change your socks anytime you want. Mm-hmm. Okay. However, when you get into the prescription drug plan or even an Advantage plan, no, you're stuck there.
Forever? Forever?
No, for the year.
Oh.
You're stuck there for the year.
Okay.
Unless, however, if the company is leaving the area or you're moving out of the service area, you can change plans.
All right.
So you're not going to get stuck.
Would people move just to change a plan?
No.
Okay. Okay.
I doubt it.
It's just, I don't know. It's daunting having to make the decision, and then I think part of what is intimidating is thinking that I have to live with this decision forever, but it's not forever.
Well, it's not forever. It's just for the year. However, another thing yet is if oh my God, did I lose my train of thought? My mind's going like crazy. It had to do with the drug plans. I'm sorry.
Well, that's okay. We'll come back to it. So I did have a question about Part D for the drugs. What if my prescription changes during the year? And
that's what I wanted. Thank you.
I knew
it. It had to do with the formulary.
Okay.
There are some times where the companies can actually pull that drug and say, well, we're not going to cover this anymore.
You signed up for my plan because I covered it, but now I'm going to not cover it.
But they have to carry two of the same kind of drug, but it might not be the drug that you're taking, the name of your drug. It might be in the same class of drugs, but it might not be the same name drug.
And then you go back to your doctor and say, here's the situation.
Exactly.
Can I take a different drug?
Right.
Oh my gosh.
Sometimes there are exceptions, though. There are exceptions, and you can ask for those things with these companies. So they do make exceptions.
Tell me, Anita, when people come to see you, what's the most problematic thing? Let's say the person coming in for the first time.
I would say picking the right plan, really finding out what their situation is, and addressing that.
And I'm not surprised. I mean, that says to me that's exactly what we're all dealing with. So, Anita, I want to thank you very much for being on the show tonight, because it's been really helpful, and I look forward to having another conversation with you. And let me just thank those of you in the audience. Thanks to my FB crew, and to you in the audience. I say this every week, and I do mean it sincerely. I do know the value of time, especially when there's not a lot of time to figure out something really important. So thanks very much for sharing another evening with me, and do join us again next time. Good night.
Full Bloom is brought to you in part by the following: